My name is Tanisha Woods, and I'm the Project Director for the Pathways to Early School Success Building Local Capacity Project. Typically, the project is referred to as Pathways. The Pathways Project is housed at the National Center for Children in Poverty, and we're also known as NCCP. NCCP is part of the Mailman School of Public Health at Columbia University. As part of the Pathways Project, we have created a set of video modules that provide information about the project and the tools. Altogether, there are 5 modules, and they are complementary to the user guide. This is the 5th video in the series. In this video, you'll learn about the Strategic Planning Tool. The purpose of the Strategic Planning Tool is to guide coalitions in the development and step-by-step implementation of a strategic plan that addresses a priority area in need of improvement. This tool draws on findings from the ECC map, the Programs and Services Mapping Tool, the Demographic and Community Data Tool, as well as coalition members' experience in the community. There are 6 steps in the Strategic Planning Tool, and I'll describe each in turn. The first step in the Strategic Planning Tool is identify the priority area. To achieve this step, your coalition should start with a discussion about the priority area that is in need of improvement. The priority area is a specific domain that aligns with your coalition's vision. For example, if your coalition's vision is that all children will be healthy, one priority area could be high-quality prenatal health care for all families. Findings from the ECC map, which provide information on your coalition's vision and relationship, and the Programs and Services Mapping Tool, which highlights gaps and redundancies in programming, will be useful for this discussion. In Step 2, your coalition will identify an outcome variable that tracks measurable improvement in the priority area. An outcome variable is the measure of an effect of an intervention or program. For example, if your coalition selects high-quality prenatal health care for all families as the priority area, a related outcome variable might be the percentage of mothers who receive high-quality prenatal care. It's possible that your coalition will identify multiple outcome variables that could be used to measure improvement in the priority area. You'll see that there is a space in Step 2 for your coalition to identify up to 3 possible outcome variables. In Step 3, your coalition will select one outcome that will be used to track measurable improvement in the priority area. Step 4 of the Strategic Planning Tool is Identify Indicators. As discussed in Video 4, an indicator is a proportion that measures a meaningful aspect of a health, education, or social care system. For example, the proportion of infants that are born with low birth weight is an indicator for how successful the healthcare system is in providing prenatal care to pregnant women. In Step 4, your coalition will identify indicators that could be used to track changes in the selected outcome. Coalition members will find that the Demographic and Community Data Tool is especially helpful in identifying indicators collected in your community. Step 5 is Select Indicators. In this step, your coalition will select up to 3 final indicators that will be used for strategic planning. The 6th and final step of the Strategic Planning Tool is the Activity Planner and Timeline. In this step, your coalition will identify specific strategies or activities to facilitate improvements in the priority area. The strategies or activities you plan should reflect the outcome you hope to achieve. After deciding which activity your coalition will implement in order to make improvements in the priority area, your coalition should use the activity planner and timeline to break up the overall activity into manageable, concrete actions with designated subcommittees or coalition members who are responsible for implementation. The activity planner and timeline will walk your coalition through this process. For example, to increase the percentage of pregnant women who receive high-quality prenatal care, a coalition might decide to host a one-day conference to educate and provide resources for early childhood and family practitioners interested in improving the health of expectant parents. First, the coalition would decide on the date for the conference. Second, designated coalition members would secure the venue. Third, assigned coalition members would invite the keynote speaker. Fourth, specific coalition members would invite early childhood and family practitioners and key stakeholders, and so on. All of these actions would be done with specific coalition members or subcommittees taking responsibility for each one. To implement the activity, coalition members should agree on a timeline and allocate resources accordingly. Keep in mind that subcommittees carrying out steps in the activity planner should regularly update the full coalition on their progress. We recommend that subcommittees update the full coalition on a monthly basis. Moreover, this tool requires that coalition members work collaboratively and reach consensus on the decisions that are made. As your coalition is working through this tool, it is likely that you will think of multiple activities that your coalition can initiate to facilitate improvements in the priority area. The activity planner and timeline can be used multiple times, and we encourage your coalition to plan as many activities as you find manageable. Examples of use for the activity planner and timeline can be found in the following PDF documents under the Resources tab on the Pathways website: Strategic Planning Tool for Engaging Stakeholders, and the Strategic Planning Tool for Cross-Agency Data Systems. And in addition to the Strategic Planning Tool that coalitions will complete for their identified priority area, we recommend that every coalition simultaneously works on a Strategic Planning Tool for Engaging Stakeholders. A printable version of this tool can be found in the Resources section of the NCCP Pathways website. After coalition members have completed the Strategic Planning Tool, we ask that members give us feedback on the tool and complete the tool assessment. From this video, you've just learned about the NCCP Pathways Strategic Planning Tool. If you have further questions, the user guide on the NCCP Pathways website is available as a resource, and your coalition coordinator and the NCCP Pathways team are available to answer questions by phone or email.